A blogger in China live-streamed her experience with a virus infection. She described her suffering. "It's the fourth day of this flu. My fever keeps coming back, and my back pain feels like it's breaking me. Even the slightest touch makes me scream like a pig. I'm begging for mercy."
Friends, this flu has truly made me question life and given me a new perspective on viruses. On the first day, I just felt a bit unwell. By the second day, I had a fever and body aches, but that was nothing compared to the third day. The fever subsided, but I lost my sense of taste. One of my ears completely stopped working. I kept coughing, and my nose was so clogged that even my mucus had blood in it. It felt utterly hopeless. Can you imagine not being able to hear anything when people talk to you? It was like experiencing life as a deaf person. So painful. Suddenly, I realized that money doesn't matter. No matter how much you have, it all goes to the hospital. Even a minor illness can cost over 1,000 yuan, with countless tests, only for it to be resolved by one pill. I figured it out. Living healthily is all that matters.
This blogger said the infection left him temporarily unable to speak or hear. Some netizens wondered if it could be a new version of COVID. They said, "Could this be an upgraded version of COVID? Where did COVID go? Is it just rebranded as the flu?" A pediatric surgeon from Shanghai's Xinhua Hospital reported that 5 children had been admitted to the ICU due to the flu, with some requiring ventilators, while others didn't survive. He explained,
Some children developed severe encephalitis and declined rapidly. Parents and kids need to wear masks anytime they go out. These cases start with a fever that spikes to 39 to 40 degrees in 2 days, followed by extreme fatigue and difficulty breathing. This flu is like a storm, taking away their vitality in no time.
A well-known male live streamer shared that his child passed away after just 2 days of fever. He wrote, "From the moment you were born, I wished you happiness and freedom to pursue what you love. I never imagined a simple fever could take your life in just 2 days." On social media, many posts recount the loss of children to sudden fevers. One person said, "I've seen numerous cases on Xiaohongshu of acute necrotizing encephalitis caused by this wave of viruses. It's heartbreaking." Another wrote, "I've come across many posts on Douyin about kids losing their lives to the flu. My co-worker's relative, a 13-year-old, died from flu-related meningitis." A self-proclaimed COVID health expert on Weibo said, "This wave surpasses 2022, but the symptoms differ. There's less respiratory distress, but there are cases where heart rates suddenly drop, and patients pass away quietly. There's no high fever or chills, but instead high fever with intense heat. Traditional Chinese medicine would describe this as severe fluid depletion, worsened by the lingering effects of COVID." Aside from fatalities, there are also reports of long-term effects. One blogger posted about her child who, after a high fever, developed viral myositis. The child couldn't stand initially, but gradually improved over 3 days, eventually walking on tiptoes. Others shared similar experiences. One said, "My 5-year-old had a fever and kept complaining about leg pain, diagnosed with flu, RSV, and pneumonia. This is his 4th day in the hospital." Another wrote, "After 3 days of fever, my son's fever subsided, but his legs hurt, and his chest felt tight. It's terrifying." Someone else mentioned their cousin suffering from post-flu symptoms, including trembling legs and blurry vision. The doctor warned of potential blindness in severe cases. From late 2024 to early 2025, multiple viruses have been spreading across China, overwhelming hospitals, especially pediatric wards, which are now as crowded as the infamous Spring Festival holiday rush. Videos shared online show packed hospitals with long lines of patients waiting to see a doctor. The situation has become dire. January 4th at Tianjin's Children's Hospital, the scene resembled a tourist crowd, complete with a guide holding a flag and a large group of people moving together. On January 3rd, Shanghai Pediatric Hospital also had a massive crowd. A video from that day shows a packed emergency room. Someone remarked,
"The flu is here, and we can't deny it. The emergency room is completely full. People with fevers, body aches, runny noses, and sore throats. It's the same situation in the pediatric department."
China's official media reported on December 28, 2024, that the Chinese Center for Disease Control and Prevention noted a nationwide increase in acute respiratory infections. Mycoplasma, RSV, and other viruses remained high, while influenza entered its seasonal peak, with flu positivity rates sharply rising. Human metapneumovirus, HMPV, also saw an upward trend. HMPV, also known as human metapneumovirus, causes acute respiratory infections with symptoms like fever, cough, and runny nose, resembling the flu. Currently, there's no specific treatment or vaccine for it. 5 years ago, Wuhan was the epicenter of the first COVID-19 outbreak. At the time, the Chinese government's cover-up led to rapid spread, turning Wuhan into a disaster zone and triggering a global pandemic that caused widespread deaths and left many families struggling with long-term trauma. Now, the rising HMPV infections have raised concerns, with some experts warning that its fatality rate could reach 43%, potentially making it the next global pandemic. As this new wave of respiratory infections spreads across China, many feel a sense of déjà vu, fearing another major outbreak. Although neither the Chinese government nor the WHO has declared HMPV a public health emergency, nearby regions like Hong Kong and Malaysia have reported HMPV cases. Cambodia's Infectious Disease Control Department issued warnings about the similarities between HMPV, COVID-19, and the flu. Taiwan Centers for Disease Control cautioned that HMPV poses a higher risk to children, the elderly, and those with weakened immune systems. On January 4th, India's health ministry addressed HMPV fears, saying that while China's outbreaks are unsurprising, India is fully prepared to handle respiratory diseases. Malaysia's health ministry announced ongoing monitoring of the situation as a preventative measure. Pakistan's health ministry directed the National Institute of Health to closely monitor the virus and held a meeting with health officials and medical experts to formulate response strategies. The UK's Independent reported that while health authorities are taking urgent measures to monitor and control the spread, Beijing has downplayed the situation, calling it an annual winter event. After HMPV began drawing international attention, the Chinese CDC announced that flu positivity rates are continuing to rise, with over 99% of cases attributed to H1N1 influenza. Provinces such as Beijing, Henan, Liaoning, and Zhejiang have also issued similar reports. A blogger known as Dr. Hui Hui shared, "Oh no, I've fallen ill. During this flu outbreak, I couldn't escape it either. My fever was nearly 40 degrees Celsius, with full body aches and a pounding headache." Another blogger, Zhang Mao, posted on January 2nd.
This virus is truly awful. Today marks my 7th day, and I finally recovered. At first it seemed like nothing, just a runny nose and a bit of coughing. I thought I could just take some medicine and get over it. But on the first night, the coughing became unbearable, so severe that I felt like I was suffocating. I couldn't breathe and started seeing stars. I rushed to the hospital and sat in the waiting room to see a doctor. While I was waiting, my fever spiked to nearly 39 degrees Celsius. When I finally saw the doctor, he looked at me with a constant frown.
The host of a food show on China's state broadcaster CCTV shared a video saying,
"My dear friends, I'm risking my life to tell you this. This flu is incredibly severe. Just the other day, I came back from skiing in northeast China, and the next evening, my throat felt dry and itchy. At first, I thought it was because I talked too much during my live streams, so I didn't pay much attention. But by last night, I started experiencing headaches and a mild fever. Then during today's live stream, I couldn't hold on anymore. Usually I stream for 4 hours, but I had to stop just after an hour and a half. I couldn't take it. Full body aches, a sinking feeling from the waist down. Forget standing. I couldn't even sit comfortably. This is H1N1 flu, and it's really severe. Plus, H1N1 can lead to a lot of complications."
While officials emphasize that H1N1 is the primary issue, many netizens suspect that COVID-19 is being rebranded as H1N1 or linked to a new virus altogether. Where has COVID gone? Has it just been renamed H1N1 or is there a new virus? Symptoms are the same as before. Fever, body aches. I don't know what virus it is, but it doesn't show up in tests. My throat feels like it's being torn apart. Then I got rashes afterward. H1N1 or not, this feels like COVID again. Some even claim this virus feels 10 times worse than COVID-19. A video posted by another blogger states, "I've tested it for you all. This isn't just H1N1, it's life-threatening. I'm on day 6 and still not recovered. My entire family is sick, and we're at our breaking point. This is far worse than COVID was back in the day." Underneath the video, countless comments share similar sentiments. "Worse than COVID. High fever turns to low fever. I'm on day 5 and still not better. My whole body aches everywhere. I feel like this H1N1 is 10 times worse than COVID. H1N1 isn't this bad. It must still be COVID. H1N1? Just a different name. The government is handling it quietly. You don't see much discussion about it online anymore. I got symptoms, tested for H1N1 and COVID, and was negative for both. My throat feels like it's been cut with knives. It must be something new. One commenter speculated that the virus could be an evolved version of COVID-19. Other netizens drew direct comparisons to their experiences. With COVID, a fever lasted 1 day, then it was over. This H1N1, high fever for 3 days, then low fever for 2 more days, plus phlegm and coughing so bad I spit blood. I haven't felt this sick in years. Most of you have H1N1, but I tested positive for COVID. I had a fever for 2 days, tested negative for H1N1 twice, and I feel like the symptoms weren't H1N1 from last year. Then I got a COVID test, and sure enough, it was positive. One user summed up their frustration. I tested for H1N1, H3N2, mycoplasma, and COVID. All negative. My throat feels like it's being slashed, and I'm coughing nonstop. It's probably something new. KP2 is the third-generation sublineage of the Omicron JN1 variant of the COVID-19 virus, and is one of the sublineages with a strong transmission advantage. On May 3, 2024, the World Health Organization classified KP2 as a variant under monitoring. Despite widespread claims on Chinese social media of overcrowded hospitals, the Chinese Communist Party has not yet released any official reports acknowledging the severity of the situation. Neither Beijing authorities nor the WHO have commented on videos circulating on Chinese social media. In contrast, on January 3rd, China's National Health Commission held a press conference focusing on the theme of balancing diet and exercise to maintain a healthy weight, starkly contrasting with the reports of overflowing hospitals. China expert Yue Shan stated that the CCP always prioritizes regime stability in handling epidemics. Even in the face of a major outbreak or possession of relevant evidence, the CCP may choose to withhold information. Warnings of another pandemic have been frequent over the past year. In January 2024, the WHO Director General warned of Disease X at the Davos World Economic Forum, describing it as an unknown pathological phenomenon that could lead to a death rate 20 times higher than the COVID-19 pandemic. Hong Kong microbiologist Yuan Kwok-yong stated in July that another viral pandemic is not only inevitable, but could cause an even greater disaster than COVID-19. In an interview at Hong Kong's Queen Mary Hospital, Yuan said, "The public and world leaders must recognize that another pandemic will happen, and it may come sooner than you think." During the initial outbreak of COVID-19 in late 2019, CCP not only concealed the pandemic, but also consistently refused to share truthful information about the virus with international investigative teams. On December 31, 2024, the WHO issued a statement saying, "We continue to call on China to share data and access so that we can understand the origins of COVID-19. This is a moral and scientific imperative. Without transparency, sharing, and cooperation among countries, the world cannot adequately prevent and prepare for future epidemics and pandemics." On December 27, 2024, China's CDC announced a pilot program for proactive monitoring of pneumonia of unknown origin. This has sparked concerns about whether the CCP is aware of the presence of an unknown virus. On January 4th, Dr. Sean Lin, a U.S. virologist and former director of the viral branch at the U.S. Army Research Institute, stated on a TV program that COVID-19 has not entirely disappeared and continues to circulate. However, due to China's lack of transparency, it is difficult for outsiders to fully grasp the situation, and there may be many more severe cases that the CCP is not disclosing. He noted that if the virus in question is HMPV, it has existed since 2001 and generally does not pose a significant threat to adults unless they have compromised immune systems. Most infections occur in children under 5 or the elderly. However, there are no specific treatments for HMPV infections. Dr. Lin also said that during economic crises, such as the current one in China, stress from unemployment and other pressures can weaken people's immune systems. He emphasized the importance of strengthening regular preventative measures and boosting immunity. He also pointed out that people's anxiety cannot be resolved solely through material means. They need spiritual support to face challenges, find inner strength, and reduce the risk of mental collapse.